Dr. Gowri will discuss pranic healing to reduce unhealthy food cravings and cases she has worked on. Dr. Gowri is a medical doctor focused on obesity, medical aesthetics, and cancer drug development. Previously, the medical compliance and regulatory director at Besins Healthcare, she has been a principal investigator in more than 20 clinical trials, ranging from phase 1 and 2 in healthy volunteers, as well as patient trials in phases 3 and 4 in medicines, supplements, and devices. Dr. Subramanian has authored various publications and posters and presented at medical conferences and health technology assessments. In the pharmaceutical industry, she has helped lobby topics at Parliament and contribute to national guidelines. She delivers medical trainings, mentors doctors and pranic healers, and she is passionate about integrating spirituality in school and family life. Dr. Gowri is the director of the British Pranic Healing Council and a certified pranic healer and a basic pranic healing instructor in the UK. Oh, I can't wait to hear this. Okay, you're on, Dr. Gowri.
Thank you very much, Barbara, and thank you, Alison, for the invitation to be part of the panel. But yeah, that's definitely a tall order to go right after the capstone speaker. So let's see. I'm going to try my best. But actually, I'm going to change it up a little bit. So I know it's so lovely to have heard from all the other speakers and their personal sharings and stories. I do have patient testimonials, but following on nicely from Master Glenn's talk, actually, it'd be nice to share perhaps a slightly different slant. So I'll come from the medical angle, and I hope that's okay to keep you tuned in. So I'm Dr. Gowri Subramanian from the UK. I'm a functional medicine specialist, so I combine traditional allopathic medicine with the energetic side. So in functional medicine, we identify and treat the root cause of the problem. So pranic healing fits in very nicely with what we do. I mean, you heard that from Master Glenn as well. So over 30 years in pranic healing and more than 40 years as a medical doctor. The best comes when you get to complement each other. So let's start with the definition of addiction. Perhaps this should have been at the very start, and I'm sorry if this was already covered before. So addiction is an impairment of control. It's important to remember that it's not a loss of control. It's just a lack of regulation in the control system. So my topic for today, yes, the original topic that I was given was pranic healing for food cravings and addictions. Now I can very easily swap the 4-letter word of food out with a different 4-letter word of emotion called love. So there are many different angles upon which we can take this topic. And in this short 15-minute talk, I'll focus on the emotion of love. We'll look at the correlation between food and emotions. Now, out of all the different addictions, food addiction and cravings, or love addictions and cravings, is the biggest and the most dangerous of all, because it's covert, it's hidden, it's silent, and it spans, because food has many different roles in our life. It's there for survival, the sustenance of our physical body. So similarly, then the emotion, particularly love, is the survival or the sustenance of our emotional body. Now, on another side of the scale, food is also part of the social status. It's a symbol of affluence, and it's part of so many cultures and part of work expectation to mingle, to be part of the event. So it can very quickly be hidden, this addiction, amongst all the other labels and relationships that we have with food. Because on the other end of the spectrum, it is a cry for help. It is a drowning. It is an absence or an emptiness or a lack of emotion. And it could be a number of different emotions. But the one we can focus on that I've seen largest in my clinic is the lack or the emptiness or the craving for love. Okay. Now, interestingly, food addictions and craving isn't linked to obesity. So let's cover the eating disorders alphabetically, so to give you an idea how this could be. So the first one up is anorexia nervosa. So this is where the person severely reduces their nutrition intake, leading to significant low body weight. Then there's ARFID, which you may have heard of, which is avoidant restricting food intake disorder. So avoiding or restricting certain foods or certain food categories to the detriment of one's health. Then we have binge eating disorder. As the name suggests, it's frequent, recurrent eating with a psychosocial negative impact. We also have bulimia nervosa. So this is regular and typically secretive eating bouts or overeating and indulgence, followed by a compensatory behavior. So the circle of binge, purge, then things like self-induced vomiting, putting the finger down, and the famous Karen Carpenter, famous people around that have also suffered from these illnesses, and then all followed by extreme diet or extreme exercise as a compensation for the compulsive eating. Then there's also orthorexia nervosa. Now, this is characterized by excessive preoccupation with healthy foods or pure, organic, biodynamic foods. And one last one is called pica. So this is non-food or no nutritional intake or nutritional value in these foods. Things like soap, paint, glue, or ashes or ice. So I've personally had that one as well. When my body was pregnant, I used to scrape the ice off the freezer and couldn't wait to consume more. It turned out I had an iron deficiency. So that's the primary root cause that we first of all have to rule out any organic pathology. So in the case of pregnancy, obviously it's a temporary thing, or if there is any iron deficiency, or we look at other causes like abuse or any persons in captive and controlling relationships, cultural, or also certain careers like maybe the film industry or modeling. So that now is a bigger problem to address, and that could be the root cause to look at that. One thing I'll draw your attention to in all these disorders, their Latin name has the word nervosa in it, meaning there is a nervousness or an anxiety or a loneliness. There's an emotional component to it. So this has been known for a very long time already. There is some link with this eating along with emotions, and many of the speakers has also touched upon that. So we can look if this is not, these are very complex disorders. And if it's, we'll look at shortly at the science behind the brain and the gut, as Master Glenn talked about, okay, because they have, as we said, addiction is a lack of control. So how these patients end up controlling themselves are things like self-harm, because that is something they are in control of. So they tend to harm themselves. And if this goes on long enough, at the other end of the scale is to take their own life. So it's a very complex illness and disorder that is, we said, very dangerous because it actually affects millions, of probably the most because of its relationship with food. So starting then with the brain, we look, there is the prefrontal cortex. This is where we have our decision making or the control, the driving center for cognition, for planning and decision making, including control of urges and our desires, as Master Glenn mentioned. In cases of addiction, as well, if it leads into eating disorders or linked with that, there's a downregulation of the prefrontal cortex. So the brain seeks out short-term pleasures or rewards despite knowing the long-term harm. And that could be any form of addiction. So then another part of the brain called the limbic system is in overdrive. So this now is the brain's reward, pleasure, and motivation center. They release dopamine and serotonin, and this ultimately are your happy chemicals, right? It's like, I feel good. Da, 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 da. Okay, so this is where the brain releases this hormone, feeling really good when it gets this pleasure, and this now becomes the ultimate decision-making system. So where is the party at? It's down in the gut, okay? So there is something called a gut-brain axis. You may have heard of this term. It's a bidirectional communication highway between the gut and the brain, or the gastrointestinal tract, as well as the brain and the nervous system. So this is mediated predominantly by the vagus nerve. Okay, the immune signals, as well as the gut microbiome. So these are the healthy gut bacteria and other organisms that get active, particularly when we consume food, and they release these happy chemicals, these serotonin and dopamine. Okay, so this is the so good, so good. I got you. So that's the food. When we then consume the food, we release these happy chemicals, and that is the loop that goes back to the brain to say, this feels good, give me more. And this is self-fulfilling cycle. So Master Glenn then talked about the role of these different energy centers, or if you're into pranic healing, we use the term chakra. So I'm equally sensitive about using those terms, because the minute you use chakras, your doctors start to switch off. Here goes this quackery again. So we use more generic language such as energy centers. Okay. So there's the two, when it comes to food, which we will see is also emotions, it's predominantly the solar plexus, that's right down in the middle, and also the navel. These are your centers for lower emotion and lower instincts. So in the case of addiction, this is where they malfunction. So these two centers in pranic healing, we learn that they have physical functions. So they do with our digestion of the food. Then, as we said, the gut microbiomes, now they then send the signals, oh, this feels really good, these happy chemicals. So now the energetic function or the psychological function of these centers is lower emotion. So the positive self-love, good self-image, wholesomeness, positive aggression, dynamism. Now, if that's not functioning properly because of an emptiness or a lack, then it holds on to other emotions from the very origin, things such as low self-worth. We said earlier, things like nervosa, nervousness, anxiety, emptiness, or even stress. So that's where you get these terminologies, butterflies in the stomach. So the emotion of stress affects our gut or gutted feeling. So again, the word feeling associated with the gut, which is where our digestives, our food digestion happen, gut instinct. So it's not from nowhere that these metaphors and similes come about. So we go to the root cause of the problem, and this is where pranic healing, I help people get out of the self-fulfilling prophecy. Okay, because it stems back a lot to the emotions that they were missing during their childhood. So now they start to judge themselves. Okay, they felt that they never got the love from their parents. The parents these days both have to go to work. So the mom is not there and the dad is not there. They're constantly working, or when they're present in the physical, they're sometimes on their phone. They come in more with rewards that are external. So if you got your good grades, you're going to get my attention. If you won your football tournament, you have my attention. So love is now attached to something external. The person themselves was not good enough to begin with. There's always this emptiness that has been constantly reinforced since childhood. Then this goes on to school, the teachers, the tiger parenting, the strict expectation, and teachers are parents themselves. So they bring those behaviors into work as well. And then that's the kind of energy that's within that person. And that's the kind of relationship that they attract based on the energy within them. So again, there's the self-fulfilling prophecy that's now getting bigger and bigger and bigger, constantly looking externally for validation to say they can tell themselves, I'm not good enough, I never was worthy of my parents' love, I'm constant failure. You can fill in the blanks. So how do they fill this? They start to eat because, again, the same centers, the solar plexus and the navel, govern also the physical aspects. And by consuming food, they get the high from that emptiness that they were seeking. So this is a larger thought form because everything starts with the subtler, and the media and advertisement play a huge part in this. You see advertisements all around. If you're feeling low, have a Kit Kat, or if you just broke up with your boyfriend, tuck into a tub of Haagen-Dazs. So this constant what we call egregors, or extremely large thought forms, the size of countries, that constantly playing in the subconscious, that you can seek your answers in inverted commas from food to compensate for the lack of emotion. So there's this loop, there's a self-fulfilling prophecy to tell them you're a loser, and that self-negative dialogue. And then food is actually a symptom. Overeating is just a symptom, a way to sustain this prophecy. Okay. And when I take my patients, so in functional medicine, we walk back to the origin of the problem. And many of this stem in childhood. Like we said, the parent is not physically available, or they show up physically, but they're not actually emotionally present. And a lot of love comes from the mom, especially in the first 7 years of childhood. There's a very strong connection, a cord between the mother and the child. And many moms show up as a yang mode. This is another concept that really takes time to break down in the consultation, because people go, no, my mom was there. But was she there in the manner that you expected and the love that they were seeking? Because a lot of these moms come in their masculine aspect, to being strict, being firm, having them to do good grades, or having material rewards, or from their fulfillment, winning their chess tournament, as opposed to, or tidy up your shoes, all these very strict parenting, whereas they need to do something in order to earn the love. Whereas what the child or the person was expecting was to be accepted as they are, through their imperfections, just looking for cuddles, the mom to show up in the yin form, the feminine aspect, the loving, the forgiving, the flowy, understanding, just simple cuddles, and accepting them for who they are. And it's not those expensive toys. So there's an inherent problem. So therefore, this is sought, and a lot of these answers are so-called found in food. Okay, so this is where I find pranic healing really helps, because it's got a dual action. Okay, yes, other modalities definitely can be combined with that as well. Whereas in pranic healing, there is the cleansing, if you like, and the energizing. So two arms or two principles. So using pranic healing modality, we remove the addiction, and I remove the lower emotions that are the origin of the problem, the lack of love, the low self-worth. And then we energize them, including creating new, the word that Master Glenn used, creating new entities, creating new thought forms, that they are whole, they are enough, teaching them self-love. Okay, and other modalities within the school, there is the technology of forgiveness, forgiving themselves, forgiving their parents. Okay, and when you get to the state of releasing a lot of this baggage, they also bring in, sorry, I forgot to say, meditation on twin hearts. So this is a very loving meditation. I think many of you have done it before. So this helps to fill their system, not then needing to look outwardly for the love, for the lack, remembering as well through gratitude and the coaching that they have this within them. They give themselves love. And as this vibration of theirs increases through the treatment of pranic healing as well as meditation on twin hearts, they then are whole and happier again, helping to overcome these cravings, these addictions. I also invite them to come and learn pranic healing because, one, they have the tools for themselves. Secondly, it's that community concept because, with addictions, you do need to come out of the triggers and that setting that they're in, or you keep falling back into the loop. So pranic healing community gives them a new breath of life, if you like. So to summarize all of that, then, addiction is a dysregulation of control. There is a neuro hijacking of the circuit. So the decision making is imbalanced from the prefrontal cortex more towards the motivation and the pleasure reward system. So there's something called the gut brain axis, and there's a very strong link between food and emotions, and particularly love. And out of all the addictions, food addictions and cravings are the covert, the biggest one, because of its many different roles food and love play in our life, from sustenance and survival to affluence and social status to the deeper, quieter, silent cry for help. So this is where pranic healing is really powerful in all the tools in the pranic healing school and modality for addiction, removing these lower emotions, which is the origin of the problem, then looking into forgiveness, positive affirmations, as well as meditation on twin hearts. So there we have it. Thank you for having me.
Thank